It's Obesity Care Week. Let's celebrate the milestones in the journey against the fight against obesity, and let's recognize and work on the milestones that we have yet to accomplish as we continue to fight year over year increased obesity trends. Hello everyone, I am Dr. Katrina Mattingly, and I'm the Chief Medical Officer here at Options Medical Weight Loss. Now, there are 5 principles to Obesity Care Week. It's a lot more than meets the eye when we're talking about people being overweight or suffering from obesity. So the first is that it is undeniable that obesity is a chronic disease. We don't gain weight within a couple of days or a couple of weeks. It's usually something that occurs over months or years. And then we start to struggle with some side effects or some chronic conditions that are a result of the fact that we've gained that excess weight. Which leads me to the next thing. Obesity is driven by powerful underlying biology, not by choice. There was this myth for decades, or this thought that people who were overweight didn't have determination or discipline or willpower or the motivation to lose the weight. Now we know that it's inherent in our DNA and in our genetics why we carry weight in the way that we carry it. Certain people carry weight in certain distributions. We may carry one type of weight more than another, such as more fat versus muscle. So it really does run in the family. The many health effects of excess weight can start early. That's the next principle. We're starting to see rates of type 2 diabetes and sleep apnea, for example, manifest itself much younger in children who are suffering from overweight or obesity. We used to see this thing typically in older generations, but we're starting to see it in our younger generations now. And sometimes we may not have that diagnosis of sleep apnea right away. Maybe we're overweight and for years we've been waking up and we've been feeling groggy. So those signs and symptoms appeared much earlier than we actually got the diagnosis and then probably just progressed. And there's a good chance they're going to get better with some weight loss. The next is that obesity is treatable. Now we have ways now that we can increase our movement, such as NEAT, non-exercise activity thermogenesis. We talked about this before, such as parking a little bit further away from the grocery store so that you have to walk more, or getting up and walking around to talk to your colleagues instead of using our internal messaging systems. So that's one way that we can combat obesity. But now we also have a brand new class of drugs that are showing really promising results in the fight against obesity, in addition to our tried and true older generations of drugs and the appetite suppressants, for example. Now we're actually able to help decrease rates of heart disease or stroke, diabetes, inflammation in the body, all these things that have typically led to or been a result of being overweight or obese. The last principle is that weight bias, stigma, and discrimination are hurtful and harmful. Now, people who are overweight or struggling with obesity tend to experience discrimination in the workplace, at school, at church, even in their own healthcare practitioner's office. It's really important that we empower them with confidence to let them know that there are resources and support to help them. Because remember, a lot of this is genetic and not by choice. And we have a lot of patients here at Options that we've helped that have struggled with weight, struggled with obesity, and are fighting against those genetics to live happier and healthier lives. If you're interested in a free consultation, then please do not hesitate to click the link below, because at Options, we really do have options for everybody.
Did you like this video? Like, subscribe, and ring that notification bell so you can stay up to date on our latest videos. You can also visit our website using the link below to schedule a free consultation with us. We have options for everybody.